Hey guys, today is day, let's see, Saturday, Sunday, Tuesday. Today is post-op day 5. Um, Definitely feeling a lot better. Woke up this morning, actually have a good night's sleep last night. I tried to sleep in the bed, but I can't do it. I think it's the action of your shoulder kind of falling back, like just due to gravity, and that's what makes it hurt. Even with all the pillows in the world, it's not comfortable. So I got back in the chair, which was right next to our bed, um, and felt good. My husband did put, um, I left it downstairs, my ice pack on, so I have it set up here. It seems like I'm just really needing it at night, and I have like those large gel packs that I've been putting on my wrist as um, as well as my shoulder. So let's see. I called the doctor yesterday because the massive bulky dressing that they have on me, I couldn't even get my husband's like shirts on. And so this is actually one of my shirts, so I was able to put it on today. Um, I spoke to the PA and he said it's fine for me to remove the dressings. I think it's because I am an NP, and so I kind of know what to look for and know what not to touch and everything. So I redressed them, and I actually just put some band-aids with some Neosporin on it. I have um, let's see, I have a hole right here, a hole here, and one right in the back. Those were the laparoscopic sites where they put the probe in. And then right down here, I have about, I thought it was sutures because that's what they keep telling me, but I guess it's about 15 to 20 staples I have sitting right here. So it definitely hurts to lift my arm, just because of where it is. It's kind of like attaches here, and then to the arm is how the staples go. So it's kind of like it's pulling when you try and move it. So definitely not trying to move it. I've been keeping it in the sling. I have been keeping the brace on as well. I haven't really taken it off except just to kind of reposition it a little bit, because I don't know if you can see, but that's a lovely, um, what's it called? Blister that I have developed. And that started the first day after surgery, or first day of surgery. So a few things that I have learned that I didn't think about. I didn't realize how difficult it is to open up your pill bottles. In the middle of the night, my pill bottles, like if my husband's sleeping, I'll try and open them. I will literally put them in my mouth and try and turn the cap off. Sometimes it works, sometimes it doesn't. So I would recommend, if you're going to be having this type of surgery, ask them for the flip top ones. I still do prefer the lock ones, the childproof ones, because I do have a 3-year-old and 4-year-old in the house, and I don't want them to be able to, you know, get them and open them, even though they're put away up high where they can't reach them. So that's one thing that was a really big thing that I didn't realize. Another thing is, you can't open anything. Like, you'd be surprised how you really need 2 hands to do stuff. So like sippy cups are really difficult. I have my 4-year-old helping me, so she'll hold the bottom and I'll screw the top on. Opening up things is just really difficult. So um, if you can get someone to help you, like if you are gonna be home and gonna be trying to make dinner or something at night before, you know, your spouse gets home, ask them maybe in the morning to open up all the jars or things that you need, just because you won't be able to do it. I just made my kids like a peanut butter and jelly sandwich for lunch, and trying to open the jelly and the peanut butter was a little rough, but we got them open. Um, Another thing that I strongly recommend is doing pump shampoo and pump conditioner. That's one thing a YouTuber um, talked about, and I was like, oh my god, I should definitely do that. And she was right. I definitely needed to do that, because today I was able to wash my hair on my own. I pretty much just kind of put my head back and turned to the side, because you need to keep this all dry, and I had a cover over it, so it kept it dry. But you can see I have a lot of hair, and so I was able to wash it and dry it, which was amazing. Another thing that I didn't realize until now, I really can move my elbow now, and I can have a little bit more range of motion in my shoulder. Um, Trying to shave, especially for women, so shaving like under your arms the first few days, you're not going to be able to. If you know in advance you're going to be having this surgery, and you don't want to have hair grow, I'd recommend getting a wax. I did not do that, and today was the first day I was actually able to shave under this arm, but still can't shave under this arm. Oh well, it is what it is. And the reason is because I can't lift my arm up to put a razor, and I don't want to risk cutting myself. Other things about the shower, I was able to wrap my own hair up in the towel. I just flipped it over, put the towel on, grab both sides, twist, 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 flip it up, and then put it tight. So you are able to do your own hair. The sports bras that I got that are closure in the front are wonderful. However, I do recommend, if you're going to get a sports bra with the closure in the front, easiest one is to do a zipper one. I have the bra closure ones, and there's like 15 of them, and so it's a little rough to get them all up. I'm able to do it now, but the first day or two my husband had to help me. I did have compression hose on, the stockings. I have been up now more than I am down, so I was able to take those off. I don't need to wear them anymore, and those were to decrease my risk of DVT. However, I still am taking an aspirin, and I have 5 more days of that. And the aspirin is just blood thinner, to prevent blood clots or DVTs as well. Definitely feeling better. I haven't taken any pain medicine today. The last time I took it was last night when my husband got home from work. It was my first day with the kids, and I'm not taking any type of narcotics when I have my kids home, and it's just me. So yesterday was a little rough. By the time he got home, I was ready for 2 Percocets and a muscle relaxant, and that really did help the pain because it was pounding by that time. Pain level at this point, I would say most of the time I'm not in pain, and then the times I am in pain, maybe a 5. So I'm definitely happy about that. So we are going away. We're going to my in-laws for Thanksgiving tomorrow night, and I can't sleep in the bed, so my husband's actually bringing the recliner. We have a big car or a big truck, so he'll just take the back off in the bottom and just throw it in the back of the Tahoe, and then we'll be able to go. But I guess I bring my own beds, which is kind of funny. Another thing I'd recommend is always keeping, especially if you're going to be hooked up to your ice machine, you definitely want to keep a bottle of water around. Keep everything that you need. What worked for me the best is I had like a little basket by the bed, and it has like my headphones in it, the remotes, my lip gloss, things like that, and then like my charger for my phone on my good side. And so I can't, it's just a lot easier to have all that stuff there. So anyway, I don't want this update to run too long, but I will update you guys again. I do want to show you how to put on the Bragg Polar Care Cube, this ice machine. This has been amazing. So I'll be putting another video out for that. I actually do plan on wearing this the whole car ride. It's about a 5-hour drive. And what I did was I bought an adapter off of Amazon to put into the old, cigarette machine, cigarette lighter things, the lighter, and it's an adapter so you can actually plug in like a regular plug. So I brought that, so I'll be able to keep this going the whole ride and give myself comfort. Today is also the first day I don't really need a pillow below my arm. Actually, a pillow tends to hurt now, and so I'm able to keep my arm to the side. It is a little bit more comfortable though to keep something, underneath, so I'm not putting all that pressure on. One thing I can say is the strap drives me crazy. I wish they made them with, some type of padding or something up here, and I'm sure they do on other ones, but this is just the one they gave me. So, all right, well, I hope you guys have a wonderful day. I'm so glad I'm feeling better. Definitely feeling blessed for that, and I will see you in my next video. Thanks so much, guys. Take care.